Welcome to the Saul's Newsstand News Review for March 1st, 2019. The Bristol Herald-Courier reports, Liberal Democrats want Medicare for all. The House's top budget guy isn't convinced. The increasingly powerful Democratic left sees a huge opening this year to promote Medicare for all in Congress, but they need to convince Representative John Yarmouth, and that's going to be tough. The Kentucky Democrat chairs the House Budget Committee and supports a limited version of health care overhauls that are dubbed Medicare for All. But as budget chairman, his job is to keep a close eye on federal spending, and Medicare for All, even in a limited form, could be seen as a budget buster. He plans committee hearings, but they could disappoint progressives who want a sweeping program delivered speedily. Yarmouth, who has asked the Congressional Budget Office to look at the details of creating a single-payer plan, says his job is to try to deal with it from the impact of the federal budget, and then let the policymakers and the candidates take it from there. A July study by the George Mason University's Mercatus Center estimated that Sanders' bill would add more than $32 trillion in government spending over 10 years. He has disputed those figures, saying his plan would decrease total health spending. In a related story, Fox News states, Bernie Sanders says no to Americans who want to keep private insurance under Medicare for All. 2020 presidential candidate Bernie Sanders said Monday night that under his progressive Medicare for All proposal, Americans would not be able to keep existing health coverage from private plans even if they wanted to do so. The Vermont senator told a CNN town hall that health care should be a human right and that the U.S. shamefully was the only major country on earth not to guarantee health care to all people. He argued that the only cost-effective way to give all Americans health insurance would be with a Medicare for All single-payer system. CNN anchor Wolf Blitzer then pointed to statistics showing half of Americans get their health insurance through their employers, and that a recent Gallup poll showed that 70% of those who get their insurance from their employers like it. The self-described Democratic socialist elaborated that under his plan, Americans could go to any doctor or hospital they wanted to and wouldn't have to pay any private insurance premiums. He also said seniors would get expanded benefits, including dental care, hearing aids, and eyeglasses. And finally, Fox Business reports, tax credit for the elderly or disabled. Are you eligible? If you are over the age of 65 or are retired due to a disability, you may be eligible for a separate tax credit designed to help the nation's seniors and disabled. To qualify for the tax credit this year, you must meet two sets of criteria. The first is the age disability criteria. You are at least age 65 or meet these three conditions. You are retired due to a disability, accepted taxable disability income for the 2018 tax year, and had not reached the mandatory retirement age for your employer by January 1st of 2018. To be qualified under the disability criteria, you must have a signed statement from a physician certifying that you can't engage in gainful activity because of a physical or mental condition. The same goes if the condition has either lasted for at least 12 months or is likely to do so, or that death is expected to result from the condition. Second is the income criteria. Your adjusted gross income, or AGI, or your combination of non-taxable disability income, pension annuity income, and Social Security income falls below threshold limits listed in IRS Publication 524. Credits for the elderly or the disabled opens a new window. Limits on AGI range from $12,500 to $25,000, while limits on the non-taxable income path range from $3,750 to $7,500. To calculate the credit, you must fill out Schedule R. IRS Publication 524 contains the instructions to help you fill out Schedule R and determine if you qualify for this tax credit. We would encourage you to read the full article by clicking on the link in the description below. And that concludes your Saul's Newsstand News Review for March 1st, 2019. For more political news faster, visit saulsnews.com.